Do you suffer from inflammatory bowel disease such as Crohn's or ulcerative colitis? Both diseases are characterized by intestinal inflammation and damage. Lesions and ulcerations in the intestinal lining impair nutrient absorption, mucus production, hormone secretion, and antibacterial peptide release, all of which further increase inflammation, damage, and pain, all of which potentiate an abnormal immune response that propagates more inflammation. This video will discuss 4 clinical interventions to both help heal and help create healthy turnover of new cells to build new healthy tissue in the intestines. We will discuss butyrate, BBC 157, nicotine, and healing emotional trauma, and then why all 4 of these interventions are critical to reverse engineer inflammatory bowel disease. Number 1, butyrate. The gut microbiome and short-chain fatty acids in our gut are crucial for maintaining intestinal barrier function and modulating the immune system. Butyrate, a key short-chain fatty acid, is crucial for promoting intestinal health. Patients with inflammatory bowel disease often exhibit reduced butyrate concentrations and also less butyrate-producing bacteria. Butyrate is the primary fuel for which intestinal cells maintain the intestinal mucus lining, the integrity of the barrier, as well as regulating the overactive immune response characterized with IBD. Clinical research suggests that a daily intake of 2 to 4 grams of butyrate can help heal the gut lining, decrease inflammation, and modulate the immune response. Dietary sources to increase butyrate include consuming butter for a direct source and eating fermented vegetables and high-fiber foods that feed our gut bacteria that produce butyrate. Alternatively, supplementing with 2 to 4 grams of microencapsulated or enteric-coated sodium butyrate can also increase gut butyrate levels. Number 2, BPC 157. Another beneficial supplement is BPC 157, a natural peptide found in our gastric juices. BPC 157 stimulates new blood vessel growth, delivering essential oxygen and nutrients to damaged or ulcerated intestinal tissues, thereby restoring endothelial integrity, decreasing inflammation, and subsequently helping to heal and rejuvenate diseased portions of the intestine. Doses of about 300 micrograms twice daily of BPC 157 are recommended. Number 3, nicotine. For ulcerative colitis flare-ups, compelling clinical research indicates that nicotine supplementation can be very helpful. Nicotine increases the production of intestinal mucin, which is often deficient in ulcerative colitis. Nicotine also decreases associated intestinal inflammation. It is recommended to use nicotine topical patch or gum, not through smoking cigarettes. However, nicotine is not recommended for Crohn's disease. Number 4, healing emotional trauma. The cells that line the intestines renew every 5 to 7 days. So why don't these cells rejuvenate into brand new healthy cells that build healthy new tissue to eradicate diseased portions of the intestine as seen with Crohn's and ulcerative colitis? Traumatic experiences are known to activate the gut-brain axis, highlighting the strong bidirectional interaction between gastrointestinal health and psychological functioning. Compelling clinical research suggests that neurotransmitters that are triggered by emotions can then become trapped within our cells and affect new propagating cells, thus perpetuating the disease process. Chronic emotions linked to interpersonal or childhood trauma, such as emotional, mental, physical, or sexual abuse, can play a significant role. Healing trauma by practicing forgiveness and building resilience are crucial for overall well-being. Forgiveness, defined as releasing resentment and anger towards someone who has wronged you, is a voluntary decision that fosters healing and improves mental health by reducing anger, stress, and anxiety while promoting optimism and peace. Building resilience through habits that cultivate a locus of control, feelings of mastery, efficacy, choice, and capacity for deliberate action, along with adopting a growth mindset, can lead to improved health behaviors and better coping mechanisms when facing challenges. You have the right to factual information to make informed choices about your health. Learn how to become resilient and improve your body composition, metabolism, and brain health by joining the RNC Restorative Health Program by visiting www.rncollaborate.com. Fees are tax deductible. I'm Lori with RN Collaborate and hope to meet you soon.